Despite the pain, you went all out to find the secret that helped you find the balance, and you made it. When you discovered that secret code, it was liberating. The skies opened up and there was no stopping you. The defining moment. That's how we make you feel at Credo Health.
Look at what is happening all over the world. The last 2 to 2.5 decades, from the infection like tuberculosis or Hansen's disease, various infectious disease, we have moved to a non-communicable disease like diabetes, the cardiac disease, the respiratory disease, and cancer. They form nearly 60% of the death anytime. If you have 100 people having a problem and death, 60% of them because of the diseases. That's the number one factor. Number two, you see all the statistics, I think most of you are aware. 77 million of diabetes, 90 million of pre-diabetes. 70 to 75% of the diabetic patient, the first 10 to 12 years, they develop a cardiac problem. And 44% of the people who are diagnosed to have a chronic kidney disease first time, all of them are diabetic. That's a very scary scenario. Then we thought we should just look at and go for this treatment, how we can do this. So if you have to make a difference in the community, you can't do a conventional treatment. What's happening in the conventional treatment? The patient goes to the doctor and the doctor gives a prescription, spend 10 minutes, 15 minutes, maximum there's a counselor. But after that when they go home, a lot of doubts, whether it is this food I can take or whether this medication is right. And those doubts in the current treatment, we have a big challenge in addressing them. They are not continuously engaged. But what method we are trying to propose? The entire treatment scenario is changing in the West. Probably in the West, 3-4 years old. In India, the last 1.5 2 years it is happening. The patient is in the middle of the treatment. Everything revolves around the patient. It's called circle of care. Whether it is your technology, whether it is your member engagement, or it is about your nutrition support, or data analytics, you have the entire health record in their mobile application. I think the entire healthcare, from a conventional, it is changing to a paradigm shift to a digital one. I think the next few years we see, probably we are a little early, 1 or 2 years ahead, but I think the entire healthcare system will change towards the digital precision.
And what I'm going to demonstrate is how does all of that come alive from a Credo technology platform perspective. So what happens is, we're putting the patient at the center of this entire healthcare ecosystem by empowering them with knowledge, data, and artificial intelligence. So in the case of our app, for the sake of the demo, we're going to pretend that I'm actually a cardiac patient with a comorbid condition of having low glucose. And to me, this is extremely helpful because with those conditions, there are two things that are actually happening here that needs to be monitored. One is all my cardiac vitals. The second thing is to keep an eye on my low glucose levels to make sure that it doesn't drop off. Now, I was recommended and referred to the Credo program by my doctor because I needed the support. So what happens when I first started with the Credo program is there were a lot of discussions between me, my health coach, and my doctor to arrive at something that's very specific, a key differentiator for the Credo technology platform, which is a precision care plan. Now the precision care plan is personalized, it's flexible, it's iterative. For a lot of us who are busy and are trying to figure out how to manage a chronic condition with technology, with the support of physicians, and make sure that we can still continue to live our life the way that we've been doing so.
So, simplest thing what I can think of what Dr. CK has visualized is lifestyle disease needs lifestyle intervention as the first therapy. It's the most important thing. Second thing is when we sit with the patient, we need to be honest here. It's like, unlike in the UK or US, they have scheduled appointments, and if they see 15 patients or more, 20 patients, it's like the busiest day of their life. Here, each doctor on an average sees at least 100 patients or more many times. So is that 1 to 5 minutes consultation, is it enough to close the bracket and make the patient understand and get the best benefit of diet, exercise, drugs, complications, education or not?
So I'm Dr. Chandrakumar, founder of Credo Health, which is a chronic condition management digital company which gives digital precision technology for all the chronic conditions. Today we have officially launched in Bangalore for the diabetes, cardiac programs, chronic condition, kidney disease, and the weight management programs. So far we have done around 2,000 patients where we have demonstrated a significant improvement in the overall clinical conditions. With that, today we are announcing the official launch to the Bangalore city public. Thank you.
Special features of this app, sir.
Yeah. So this, the mobile application is completely evidence-based, clinically validated, and AI-powered. That's the biggest differentiator. And also we give a comprehensive chronic condition coverage. Thank you.
Hi, I'm Dr. Lalitha Krishnamoorthy, and I'm the co-founder of Credo Health Services, and I'm also the technology advisor for Credo Health Services. And Credo Health platform was created primarily to make sure that the patient, the member who is suffering from a chronic condition, whether that's hypertension, diabetes, or it is wellness, weight management, or it is kidney disease, has an opportunity to be in the center and be the centerpiece of the healthcare ecosystem. And they're given knowledge, data, and artificial intelligence in order to support them maintain the lifestyle that they want to maintain. So that's what we've built as the technology platform for Credo Health Services. We actually have multiple different levels of plans. So we have a basic plan, we have a premium plan, we have a quarterly plan, a 6-month plan, and a yearly plan. And the charges for each of these, depending upon your condition, do you have a comorbid condition? Like, for example, the demo I showed today was cardiac and diabetes. So if there are combinations of these, then it varies. But all of this is actually on our website as well. So you have the different services, the subscription, and the plan rates for all of them. So you could definitely look at those as well and reach out to us if you want more information.
ಅಪ್ಲಿಕೇಶನ್ನ ಲಾಂಚ್ ಮಾಡಿದ್ದೇವೆ. ಈಗಿನ ನಾವು ಜನಸಾಮಾನ್ಯರ ಸ್ಥಿತಿ ನೋಡಿದ್ರೆ ತಂತ್ರಜ್ಞಾನ ಮತ್ತು ಆರ್ಟಿಫಿಷಿಯಲ್ ಇಂಟೆಲಿಜೆನ್ಸ್ ಇಲ್ಲದೆ ಯಾವ ಕಾರ್ಯನೂ ನಡೆಯೋದಿಲ್ಲ. ಸಿಂಪಲ್ ಆಗಿ ಒಂದು ಟಿಕೆಟ್ ವಿತರಣೆಯಿಂದ ಹಿಡಿದು ಈಗ ಆರೋಗ್ಯ ಕಡೆಗೂ ಇದು ನಮ್ಮ ಮುಂದೆ ಹೋಗುವ ಜೀವನ ಶೈಲಿಯಲ್ಲಿ ಇದೊಂದು ಅಳವಡಿಕೆ ಆಗಿಬಿಡುತ್ತೆ. ಸೊ ಈ ಒಂದು ಆರ್ಟಿಫಿಷಿಯಲ್ ಇಂಟೆಲಿಜೆನ್ಸ್ ಮತ್ತು ಡಿಜಿಟಲ್ ಹೆಲ್ತ್ನ ಒಂದು ಹೆಜ್ಜೆ ಕ್ರೆಡೋ ಹೆಲ್ತ್ ಅಂತ. ಸೊ ಇದರಿಂದ ರೋಗಿಗಳಿಗಷ್ಟೇ ಅಲ್ಲ, ಈವನ್ ಜನಸಾಮಾನ್ಯರಿಗೆ, ಕೆಲವರಿಗೆ ಬೊಜ್ಜಿನ ಸಮಸ್ಯೆ ಇರೋರಿಗೆ ಅಥವಾ ಮಧುಮೇಹ, ಅಧಿಕ ರಕ್ತ ಒತ್ತಡ, ಹೃದ್ರೋಗ ಸಮಸ್ಯೆ, ಕ್ಯಾನ್ಸರ್ ಸಮಸ್ಯೆ ಇದ್ದವರಿಗೆ ನಾವು ಯಾವತ್ತೇ ಹೋಗಿ ಒಂದು ವೈದ್ಯರನ್ನು ಸಂಪರ್ಕ ಮಾಡಿದಾಗ ಒಂದು 5-10 ನಿಮಿಷ 15 ನಿಮಿಷ ನೋಡ್ಬೋದು ವೈದ್ಯರನ್ನ ಹೊರತು. ಅದ್ರ ಮೇಲೆ ಮತ್ತೆ ನಾವು ಅವ್ರನ್ನ ಹೋಗಿ ನೋಡೋದು ಆನ್ ಆ್ಯನ್ ಆ್ಯಾವ್ರೇಜ್ ಮಾಹಿತಿಗಳ ಪ್ರಕಾರ ವರ್ಷಕ್ಕೊಮ್ಮೆನೇ. ಸ್ಟಾರ್ಟಿಂಗಲ್ಲಿ ಸ್ವಲ್ಪ ಬೇಗ ನೋಡ್ಬೋದು. ಬಟ್ ಸೊ ಈ ಒಂದು ಗ್ಯಾಪ್ನಲ್ಲಿ ಏನೇನು ನಡೀತಾ ಇದೆ, ನಿಮಗೆ ಹೋದ್ಮೇಲೆ ಈ ಮಾತ್ರ ಊಟದ ಮುಂಚೆ ತೊಗೋಬೇಕಾಗಿತ್ತಾ, ಊಟ ಆದಮೇಲೆ ತೊಗೋಬೇಕಾಗಿತ್ತಾ, ಬಾಳೆಹಣ್ಣು ತಿನ್ಬೋದಿತ್ತಾ, ಇಲ್ಲ ಕೇಳೋದು ಮರ್ತೋಯ್ತು, ಇವತ್ತು ನಾವು ಜಾಸ್ತಿ ವ್ಯಾಯಾಮ ಮಾಡಿಲ್ಲ ಹೇಗೆ. ಸೊ ಈ ಥರ ಎಲ್ಲ ಬಹಳಷ್ಟು ನಾನಾ ಥರದ ಒಂದು ಡೌಟ್ಗಳು ಬಂದೇ ಬರುತ್ತೆ ಮನಸ್ಸಲ್ಲಿ. ಸೊ ಈ ಒಂದು ಡೌಟ್ಗಳನ್ನು ಕ್ಲಿಯರ್ ಮಾಡಲಿಕ್ಕೆ ಮತ್ತು ಮಧ್ಯದಲ್ಲಿ ಹೆಲ್ತ್ ಕೋಚ್ ಅಂತ ಇರ್ತಾರೆ, ವೈದ್ಯಕೀಯ ಈ ಸಂಸ್ಥೆಗಳಲ್ಲೇ ಇದ್ದುಕೊಂಡು ಕೆಲವು ತಿಳಿದುಕೊಂಡು ಮತ್ತೇನಾದರೂ ಅಧಿಕವಾದ ಇನ್ಫಾರ್ಮೇಷನ್ ಬೇಕಂದರೆ ವೈದ್ಯರಿಗೆ ಸಂಪರ್ಕಪಟ್ಟು ನಿಮಗೆ ಅದರ ಬಗ್ಗೆ ಮಾಹಿತಿ ಹೇಳ್ತಾರೆ. ಸೊ ಮುಂದೆ ಹೋಗ್ತಾ ಲೈಫ್ ಸ್ಟೈಲ್ ಕೋಚ್ ಬೇಕಾಗ್ತಾರೆ. ಈ ಒಂದು ಕಾರ್ಯಕ್ರಮ ಬೇರೆ ಹೇಗೆ ಭಿನ್ನ ಅಂತ ಅಂದರೆ ಇದರಲ್ಲಿ ನಿಮ್ಮ ವೈದ್ಯರನ್ನ ನಾವು ತೆಗೆದು ಬಿಸಾಕ್ತಾ ಇಲ್ಲ. ಕೆಲವರು ಡೈರೆಕ್ಟ್ ಟು ದ ಕಸ್ಟಮರ್ ಮಾಡಿದ್ದಾರೆ, ಡೈರೆಕ್ಟ್ ಟು ದ ಕನ್ಸ್ಯೂಮರ್ ಮಾಡಿದ್ದಾರೆ. ಸೊ ಅದ್ರಲ್ಲಿ ವೈದ್ಯರ ಸಂಪರ್ಕನೇ ಇರೋಲ್ಲ, ಅವ್ರು ಏನು ಹೇಳ್ತಾರೆ ಅದೇ ಕರೆಕ್ಟ್ ಅಂತ ಅನ್ಸುತ್ತೆ. ಸೊ ನಿಮಗೆ ಏನು ತೊಂದರೆ ಇದೆ, ಈಗ ಏನಾಗ್ತಾ ಇದೆ, ಅದರ ವೈದ್ಯರ ಸಂಪರ್ಕದಲ್ಲಿ ನೋಡಿಕೊಂಡು ಅದಕ್ಕೆ ಒಂದು ಬದಲಾವಣೆಗಳು ತರ್ತಾಯಿದ್ದೀವಿ. ಈ ನಿಟ್ಟಿನಲ್ಲಿ ನಾನು 100ಕ್ಕಿಂತ ಹೆಚ್ಚು ಪೇಷಂಟ್ಸ್ಗಳನ್ನು ಈ ಒಂದು ಆಲ್ರೆಡಿ ಕಾರ್ಯದಲ್ಲಿ ತಗೊಂಡಾಗ ಅದನ್ನು ನಾವು ಪೇಪರ್ ಮಾಡಿ ಅಮೆರಿಕನ್ ಡಯಾಬಿಟಿಸ್ ಅಸೋಸಿಯೇಷನ್ಗೆ ಸಬ್ಮಿಟ್ ಮಾಡಿದ್ದೇನೆ. ಸೊ ಜೂನ್ ತಿಂಗಳಲ್ಲಿ ಆ ಪೇಪರ್ ಸೆಲೆಕ್ಟ್ ಆಗಿದೆ. ಸೊ ಅದನ್ನ ಬಗ್ಗೆ ಮಾತಾಡಲಿಕ್ಕೆ ಅಲ್ಲಿ ಹೋಗ್ತಾ ಇದ್ದೇನೆ. ಸೊ ನಾನು ನೋಡಿರೋ ಒಂದು ನಿದರ್ಶನ ಅದರಲ್ಲಿ ಏನು ಅಂದರೆ, ಮೊದಲನೇದಾಗಿ ನಾನು ಅಧಿಕವಾಗಿ ಮಧುಮೇಹಿಗಳನ್ನೇ ತೊಗೊಂಡಿರೋದು. ಅವ್ರದ್ದು HbA1c ಪ್ರಮಾಣ 1.8% ಕಡಿಮೆ ಆಗಿದೆ. ಯಾವುದೇ ಒಂದು ಮಾತ್ರೆ ಹಾಕಿದಾಗ 1.3 ಆಗೋದು. 1.8 ಅಂದರೆ ಜೀವನ ಶೈಲಿ ಬದಲಾವಣೆ ಬಹಳ ಮುಖ್ಯ ಅಂತ ಅದರಲ್ಲಿ ಹೇಳುತ್ತೆ. ಎರಡನೇದಾಗಿ ಅವ್ರ ಕ್ವಾಲಿಟಿ ಆಫ್ ಲೈಫ್ ಕೂಡ ಇಂಪ್ರೂವ್ ಆಗಿದೆ. ಮೂರನೇದಾಗಿ ಯಾವುದೇ ಒಂದು ಟ್ರೀಟ್ಮೆಂಟು ಅಥವಾ ಯಾವುದೇ ಒಂದು ಫೋನ್ ಏನೋ ತೊಗೊಂಡಾಗ ನಿಮಗೆ ಮಾತ್ರ ಉಪಯೋಗ ಆಗುತ್ತೆ. ನೀವು ಜೀವನ ಶೈಲಿ ಬದಲಾಯಿಸ್ಕೊಂಡ್ರೆ ನಿಮ್ಮ ಕುಟುಂಬದಲ್ಲಿ ಎಲ್ಲರಿಗೂ ಕೂಡ ಉಪಯೋಗ ಆಗುತ್ತೆ. ಸೊ ಆ ಒಂದು ನಿಟ್ಟಿನಲ್ಲಿ ಇದೊಂದು ಬಹಳ ಮಹತ್ವವಾದ ಒಂದು ಅಂಶ ಅಂತ ನಾನು ಹೇಳಲಿಕ್ಕೆ ಇಷ್ಟಪಡ್ತೇನೆ. ನಮಸ್ಕಾರ.